Thanks, John. Well, while pregnancy can be a joy, it certainly also brings a certain amount of pain. And this morning we get some tips for moms to be on how to deal with that pain. Physiotherapist Lynn Williams joins me this morning. Good morning, Lynn. Thanks for being here.
My pleasure.
I'm all too familiar with some of these pains at the moment. But let's talk about, there are actually a lot of physical changes that take place beyond the obvious. What happens to a woman's body during pregnancy?
Well, there are. One of the key factors is relaxin, a hormone that's secreted. What this does is it tends to expand all the joints in the body. One of them is the rib cage. So a lot of women will tend to get pain related in their shoulder blades because of rib displacements. Another thing is sacroiliac pain, which is just an area right here. Okay, this area right here is basically opening with that relaxin being secreted. So those areas are opening to allow for the birth canal to widen, and this area can give a lot of pain as well.
This is my problem area, I think, as well.
Most common.
It's almost like sometimes like I'll stand up and I actually feel like I'm crooked or twisted. Like it's like things
like something's off. Like
things aren't
right.
being held together. Right.
Exactly.
Are there any injuries that sometimes happen?
Yeah. So this is probably the most common thing that I see in the clinic for ladies that are pregnant, even postpartum as well. Basically, the best thing to do is to prevent by making sure you don't do a lot of asymmetrical type movements. So being careful getting in and out of the car is one key thing. You know how you put one leg in and sit down. That's a very asymmetrical movement. It puts torsion on the pelvis, and this can be problematic.
So
things
like
sit first
slide,
and then swing the legs in. Exactly. Yeah. Same thing. Sleeping at night, try not to have cross one leg over the other using a body pillow, because again that puts torsion. Walking on the beach, unfortunately, is one of those things. When it's a banked surface, it's causing more pressure on one side than the other. Now, if you've had trouble with this area before pregnancy, there is a high chance that you could develop this type of thing again. So what we do typically is we have people come into the clinic, assess what type of things they need. Do they need more abdominal strength? Do they need manual therapy techniques to help relieve some of the pressure on these joints? Or people sometimes will need as well a stabilization belt, which is basically something that's very simple and it's just worn around the hips, and that can help stabilize this lower sacroiliac area.
Okay, so I would have thought like you need something a lot more massive.
It depends on what the problem is. This is worn very low, so it doesn't impact the abdomen area. So if it's found that this area, the lower part, is to be a problem, then that would be a more suitable belt. If it's more because of the weight of the abdomen, so the center of gravity, also another physical change, really increases the curve in the spine. This natural curve in the spine gets larger, especially if there's a large weight gain quickly. And maybe in that case, you might need a support, which unfortunately I don't have here today, but it really supports the weight of the abdomen. So it really does go under the abdomen and around the back, even have some that come up over the shoulders, and that kind of support would help support the weight of the abdomen if that's deemed to be what is causing your pain.
Are there things from the time you sort of find out that you're pregnant, are there sort of preventative exercises that you can start doing?
Absolutely, absolutely. One of the key things is definitely Kegel exercises, and there's lots of different ways to do those. And then the other things are incorporating the Kegel exercises with some abdominal exercises that are, of course, safe and in certain positions for pregnancy. Obviously, not lying on the back after the first trimester is important. So there's different ways we can do it, like 4-point kneeling, so standing on all fours on your hands and knees. We can do abdominal exercises in that way to help stabilize, and that will definitely go a long way to preventing some of these discomforts.
Okay. Now, I was actually talking to a friend of mine who, after she had her baby, that was when everything just really fell apart for her. So sometimes women think, and I guess I assume, like, oh, can't wait to have this baby because my problems will be gone. But there are problems after a baby, right?
And it really depends on what is causing the problems to begin with. So if it's just the baby weight, like sometimes just the size of the baby will put pressure on nerves in the back and they can give pain. So if that's the case, then usually once the baby is born, there's no problem after. The problem comes when, if you have another child at home and you're carrying that child around as well, and the new baby, you're lifting them, you're carrying them, you're putting a lot of strain on the back, especially now that the abdominals are not working as well as they should be. They've been stretched out, they're not working as efficiently. So definitely being careful of how you're lifting the baby, how you're carrying the car seat as well. Things like that
that thing's heavy.
Yeah, are really important after, and it's really important to regain that abdominal strength as soon as possible after the pregnancy or after the delivery.
Away. And I think probably don't be afraid to talk to your OBGYN and get a referral to physio.
And that's the key thing, to make sure that it's safe to go ahead and do those exercises, depending on if you've had a vaginal or a C-section delivery. That'll make a difference for when you can start those exercises. Right? So it is really important to have your doctor prescribe when it would be appropriate for you to start those exercises.
You have a free workshop coming up. as well.
We
Tell
do.
me about that.
Yeah, this is going to be the second one that we've given. It's July 7th. It's a Saturday morning. Okay. It's from 10 till 11 o'clock. It's about an hour. Usually I speak for about 45 minutes, 50 minutes, and then there's time for questions. It's basically going to talk about the things that we just talked about, different changes, physiological and physical changes that happen during pregnancy. It's going to be different types of injuries so that people can be aware of what type of symptoms to look for and when they should consult a physiotherapist or their doctor about these problems, and then what physio can do and the types of exercises that can be done to help prevent these problems.
I do find personally, I don't know if this is for other women as well, sitting is my enemy.
Yes, it can
Like,
be definitely.
It's terrible.
You want to ideally have a good chair that's supportive.
Okay.
And ideally you're not sitting for longer than a half hour at a time. You know, even if it just means getting up
Get
for a
up and
minute
move
and just
around.
move around a little bit. But definitely some support in the low back. So a chair that has a nice lumbar support is ideal. And if you don't have a chair with a lumbar support, you take a small towel, roll it up, and put it in your low back, and that actually supports quite well. And then there's little exercises and stretches you can do during the day, and we cover some of these in the workshop as well.
All right. Well, Lynn, thank you so much for joining us
Thank you.
this morning. Don't forget the workshop is Saturday the 7th at 10 o'clock at A Step Ahead Physiotherapy, and you can find them over at Governor's Square.